Hello, amigos. Nice to see you again. Let's enjoy Dr. Y chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Today we're gonna talk about PET-CT. Chapter 45. What is PET-CT? Cancer and PET-CT made easy. Let's go. PET, positron emission tomography. What is this? PET is a functional imaging technique that uses radio tracers to visualize and measure the changes in metabolic processes. Actually, the positron is an antiparticle of electron. PET-CT is a fusion image, actually PET plus CT. We used to say PET-CT or sometimes PET/CT, and formally we say CT-PET. Radio tracer. What do we use in PET-CT? Usually in the medical practice, we use 18-FDG, 18-fluorodeoxyglucose. It is a glucose analog, and this glucose analog shows heart uptake area when glucose or FDG metabolism is high. Before entering this chapter, I want to introduce the fused creature because we are in the chapter of fused imaging technique. The Sphinx. Sphinx is a mythical creature with the head of a human head, with the body of a lion and wings of an eagle, sometimes with the tail of a serpent. This painting is the famous one, Oedipus and Sphinx by the painter Gustav Mahler in 1864. This is oil paint in canvas, 2 and 1 meter in size. It's displayed in Metropolitan Museum of Art. This is from Wikipedia. On your right side, we see the wise man, Oedipus. He answered the question. The answer was human. The question was raised by this left side creature, Sphinx. Beautiful woman face, beautiful woman breast, with the eagle's wing and the lion's body. This Sphinx fell from the cliff and died because too ashamed to live because the Oedipus answered the question. Interesting. Preparation for the exam of the patients. At least 8 hours of only water drinking, no food, and no sugar and less carbohydrated food. No hard exercises such as marathon, cycling, aerobic, or swimming. The process for the patient at the PET-CT room is like this. First, check the blood sugar level, and then IV injection of FDG, and then take a 1-hour rest for FDG uptake in the body, and during resting, drink water half liter for 1 hour, and then exam start 1 hour after injection of FDG. The exam time will be 20 to 40 minutes. PET-CT image examination process is in this order. First, check CT scan, and then PET examination, and then make fusion images and color coding, and then the reading or interpretation by the doctor. As I told you before, the tracer is 18-fluorodeoxyglucose, in abbreviation FDG. Fluorine 18's half-life is about 2 hours, so we need cyclotron nearby the hospital of examination. Dr. Fogel and Wainwright said in 1969 like this: structure without function is a corpse, and function without structure is a ghost. It means structure, the body needs function, the mind, and function, the mind needs structure, the body. It can be applied to PET-CT. PET-CT is the fusion of a PET and the CT. PET usually shows us the metabolism, CT shows us the anatomy, PET shows us heart uptake, CT shows us the shape, PET shows us the function, CT shows us the structure. But when you combine these two machines, fusion PET-CT can show us the metabolism and the anatomy, heart uptake and the shape, function and the structure. So the fusion PET-CT is much more beneficial than the single PET study plus a single CT study. This is one of the rear PET-CT machine of Philips company. On your left side, the table for the patients. On the left side is for the foot. On the right side is for the head. And first gantry is a CT machine. And the second gantry is PET machine. Now I will explain you the glycolysis metabolic pathway of PET study. It is in the paper of An Introduction to PET-CT Imaging by Dr. Bibu Kapoor in Radiographics, year 2004. Metabolism, the glycolysis means the conversion of glucose into pyruvate. In this pathway, there appear two enzymes. First one is glucose transporter at the cell wall, and second one is hexokinase in the cytoplasm. This is the figure, and the navy color is nucleus, and the green is the cell wall of our body, normal or abnormal cell wall. And at the outside, there is a glucose or FDG. In the cell wall, glucose transporter make them into the cytoplasm, and the glucose, usual glucose, go phosphorylation by hexokinase. Glucose 6-phosphate, and then at all. And FDG gets the same way, but after FDG 6-phosphate, it blocked. It remained in the body cell for a longer time than normal glucose. So we can take the image of this FDG. That makes this study perfect. The actual role of the PET-CT. Cancer detection? Not always. Inflammation detection is actually also included. We think we found the cancer cell when we see the heart uptake. Nope. Actually, it is the hypermetabolic cell of glucose metabolism. And more accurately, actually, 18-FDG hypermetabolic cell. That is the cancer and also the inflammation cells. Let's enjoy the pictures of the small cell lung cancer on this chest X-ray and the CT. This is the large mass in right upper lobe of small cell lung cancer and many large conglomerated lymph nodes in the right mediastinum. On this actual CT, we see the right upper lobe large small cell lung cancer and 2R lymph node enlargement of small cell lung cancer. How about the small cell lung cancer? In these patients, MIP PET-CT imaging. All summated data are here in the single image. Small cell lung cancer here is showing us as heart uptake, and in many conglomerated lymph node also shows heart uptakes. Are they all? CT, chest CT and chest X-ray showed this only. But how about on this PET-CT fusion imaging? Vertebral metastasis, femur neck metastasis, upper femur metastasis. Yes, we see much more than the CT can show on the PET-CT fusion image. On your left side, this one, axial tomographic image of a PET, shows heart uptake as black, dark, thicker density here, lymph node. And this actual tomogram CT image shows consolidation of small cell lung cancer here and lymph node here and here as structure and anatomy. PET is function shown here. Anatomy are shown here. How about the fusion of these two images, two studies? Yes. Where the heart uptake is. That is the important one. Where is heart uptake is. This PET and CT fused image shows hypermetabolic activity and where it is, the address of the hypermetabolic heart uptake area. Yes, finally, this single image, summated tomographic data of heart uptake and the anatomy is on this MIP PET-CT image. This is the benefits of a PET-CT fusion image in diagnosis. Now it's finished. How do you feel now? Are you happy? Made it easy or still difficult? Anyway, congratulations for your finishing of a PET-CT Chapter 1. Sir, you quit smoking? Wow, you are so awesome. Of course you subscribed. Thank you. Be happy, healthy, and wealthy. PET-CT is very easy, right? See you next time with the topic of the role of PET-CT in lung cancer patients, the Chapter 2.